Welcome. Welcome to this Consumer's Doctor on Personalized Healthcare channel. We have been talking about personalized healthcare and different issues related to personalized healthcare with personal care accounts. This is uh, this is the only way we can lower the health premium, folks. Let's concentrate on the health premiums, how the premiums are based, how the insurance companies base the premium. Right now, as we speak, the insurance companies' premiums are based on general risk. General risk. When I say general risk, you're among the 320 million folks. Your premium is based on 320 million. And that is just not right. And premiums keep rising. We have spent $3.7 trillion in 2019, and we still rank 37th among the most advanced countries in the world. That is simply not acceptable, folks. There are two things we need to be focusing on. One is the health insurance premium, and the second one is health care cost. Today, I'm going to focus on health insurance premium. Why is it so important, the health insurance premium? Because health insurance premium are based on everyone else with your premiums are based on somebody else is being a drug addict, somebody else being a smoker, somebody else being a high obese, and somebody else not having an insurance coverage. That is ridiculous. You cannot have a premium based on general risk. This article which I'm reading from an actuarial with 50 years of experience, he basically says this is just not right. What insurance companies are doing is just not right. Your premiums, their actuarial base their premiums on general risk. They don't categorize. Majority of the American folks, we are healthy. Majority. You're talking about 68% of the Americans are healthy. Why can't they get a premium based on their health status? If they don't see their doctor, if they don't have any medical condition, if they haven't seen any physician, so they don't have any health issues to talk about, their premium should be lower. It's as simple as that, folks. What it bothers me the most, and none of the leaders in Washington is concerned about it. That bothers me the most. Representatives in Washington, they're not even looking into it. Only thing they want is one size fits all, but they're not going to the nitty gritty of how these premiums are based on. That's how the Obamacare failed, because it's a premium based mandated policy, which is not right. Actually, only premium based, folks. It has nothing to do with healthcare. It has nothing to do with that. What I'm saying is 68 of the folks who are like, you're talking about 200 million blue collar workers and their families, and you're talking about the rest of the small business employees, employers who are healthy, and their premiums are being based on the entire 320 million, even with no insurance. So you're paying for the people with no insurance. So you're paying for it. So basically, they're punishing you for somebody else's mistake. That is just not right. So what I'm seriously looking at, I've really analyzed this, Ron Bachman's actuarial principles, which makes sense to me. I have spoken to him. I have, again, I admire him for his frank opinion. The the premium should be based. Your health insurance premium should be based on, if you are a healthy individual, you should be categorized into well category. 68% of the folks who are in well category, the premium should not be more than, what I saw is a deductible plan is $158 to $200, folks. $1,500 deductible plan. So you can put money aside into the personal care accounts, so-called health savings accounts. This personalized health care, so-called HDHP, HSA, what I have renamed it to make it simple. Health disclosure, health plan with health solutions advantage. Health solutions advantage is nothing but an HSA account. It is your personal care account. I wish the Washington invest in Americans. I wish they invest $6,000 per person in the first year to invest in. Right now, they're talking about giving $2,000 because of the COVID pandemic. I would say they should even fund $6,000 first contribution from the Washington. So if they do that, you are in the driver's seat, folks. Americans are in the driver's seat. Americans will control. Anytime customer is in the front line, believe me, that's the only way it can lower the cost. You know why? Customers will demand. Customers will demand affordability, and they will demand competition, folks. There is no competition in healthcare right now because they're all consolidating. The medical groups are consolidating, hospitals are consolidating. That's just not right. That's not the way to go. We need more competition among the providers, all the providers, doctors, hospitals, diagnostics, and we need an open competition, folks. This is where we are making a mistake. By consolidation, you're driving the competition away. Consumers are not going to like it. If you put the consumers in the driver's seat, they will demand competition and they will demand price transparency. Effective January, we are having a price transparency across all the hospitals, including the providers, the doctors, healthcare professionals. It is price transparency is a must. We need to have even pharmaceuticals. What I see is, pharmaceuticals taking a full advantage. Every time there's a new drug comes up, and they keep advertising on the television, folks. The so-called R&D, research and development, whatever the cost, if they cost several millions, they're deducting from the taxes. That expenditure is being deducted, but that is not being given the advantage to the consumers. Consumers are not getting the benefit. When they're deducting from when the company files taxes, pharmaceutical companies file taxes, R&D is deducted from their expense. When they're deducting it, they should give that benefit to the consumers, which they are not doing it. I'm telling you, whenever they advertise a new drug on the television, they need to have priced. We see prices for all the products on the TV. What's wrong in having a price transparency among the pharmaceuticals, drug companies? Anytime there's a new drug comes up, they basically big pharma is taking deductions in their filings and annual filings, but they're not giving that, whatever the deduction, they're not giving that deduction to the consumers. They need to include that deduction and give the price should be forwarded to the consumers because they have already deducted from their expenditure. So these are the things we need to look into that, folks. Consumers, you know, you know, and like any other sector, retail, health, agriculture, you name it, like groceries. What is the difference between groceries and food chains to the healthcare industry? I don't see any difference, folks. I do not see a single difference. Healthcare is overregulated, burdensome. This is what was happening to the airlines in 1980s. They did the same thing to the airlines. What happened when they deregulated the airlines? Prices crash. Prices crash. I know, I was there. I've been there. I've done that. Prices has fallen. Airline tickets, the prices went down so dramatically when they deregulated the airline. We want the same thing in the healthcare, folks. Deregulate. There's too many regulations. It's being choked by. They're over-regulating the hospitals, over-regulating the doctors, over-regulating. You name it, they're over. Every time there is there is a advantage for the consumers. They're ignoring the consumers, folks. Ignoring you, Americans. They are making policy based on premium, based on what the insurance company decided 40 years ago. That is not even a true number, folks. Whatever the premiums you're getting, you're paying, that's not the right number. They need to categorize healthy folks into well category. Okay. Number 2, let's talk about acute illness. Acute, there is a well category, there's an acute, so all risk. At risk, it's called at risk category. At risk category is for acute conditions. People who smoke, they get pneumonia. People who have high blood pressure, they get strokes. People who are diabetics, they get complications from diabetes. People who have high blood pressure can have a heart failure. These are people are at risk. Folks who are on drugs are at risk. Their premiums need to be based on if they're taking drugs, they're at risk. So their premiums should be at risk. So you cannot neglect that because anytime any drug goes into your body, you're prone because drugs have side effects. Any drug, it doesn't matter. It doesn't have to be, cannabis. Any drug, if you take into your body, has a side. So you're at risk. So your premiums, there are only 15% of the population are at risk, folks. 12 to 15%, not even 15, 12 to 15%. But their claims are higher. Their claims are around 20%. Well category, the claims are only 12%, whereas at-risk category, their claims are around 20%. So your premiums need to be based on when an actuarial calculates the premium, depending on how many people are. And if you look into across the state lines, they need to compete, man. They need to compete at risk category. If I have a driver's license in California, if I need to buy insurance, I can shop around state insurance across the state lines. We should have the same policy, folks. We should compete for the state insurance premiums based on at risk. So at risk category premiums also, you need to, because of the online telehealth, telemedicine, we can give them classes, smoke cessation, management of high blood pressure, management of obesity, management of heart failure. These people need to have, like a driver's, if you go to the DMV, your premiums, your insurance payments goes down The same way, folks, if you go and take classes for your smoke cessation classes, obesity classes, your premium should go down because you've already taken enough precautions to manage yourself. So your premium should be based on where you stand at risk. Well, the next one, folks, this is where the tricky one is the chronic illness. Third one. This is the most important category. You know why? Because 18% of the population have chronic illnesses, but their claims are 48%. You're talking about half of the claims are coming from these folks. You need to focus on them. That's where our focus. Instead of punishing everybody, focus on 18% of the population. Is it so difficult to focus on 18% of the population with chronic illnesses and their premiums? We should make every effort to make premiums go down. And we should make every effort so that we can get all these folks should have insurance. Health Review Authority will look into that, and if they qualify economically or physically, they should. It is a must. These are the folks we need to pay attention the most, because this is where the claims are. Half of the claims are. This is where our half of the expenditure going into these chronic illness, folks. This can be handled with technology, with AI, with you name it. Blockchain. You're talking about ledger system, payment system. Everything goal is to lower the payments, the costs. And what I see here is the billing system. Those hospital charges, they're not the right number, folks. I don't know who came up with those CPT and DRG codes. These are not the consumer decides how much they want to pay. It is not between you or anybody else. Let consumer decide how much to pay. Is that difficult if the consumer is in the front line, he can pay a penny for everything he gets it. If he demands, he'll get it. Consumer always wins, folks. Consumer always wins. This is where we need to bring the consumer into the front line to get the health insurance to get a cheaper health insurance, and also get the lower cost care. Let providers compete, man. They have to compete. That's the only way we can bring this cost down. There is no competition. You need to have, right now with telemedicine, telehealth, all these doctors, they don't need these offices and expenditure, all these mid-level agencies, mid-level managed care organizations. They are redundant. You don't need it. We are spending 15-20% to the mid-level agencies for a management. And I've seen healthcare professionals taking full risk contracts, and they're charging 15-20% for a management. Healthcare professionals, they're supposed to be taking care of the patients and taking care of you and me. They're into business now. They're collecting money from Medicare, full risk contracts. Healthcare professionals, I'm not kidding. Healthcare professionals are collecting every month, they're collecting the full risk contract. So healthcare professionals are becoming a business. So if that's what it is, I have no problem with it. But consumers have to decide how much they're going to pay. It's not up to you or me or anybody else. Let consumers. I can go and have the surgery anywhere at a reasonable cost because I'm putting my money in from the personal care accounts. I can have a knee surgery for 8-10 grand. Believe me, I can do it. I can have a CAT scan done for 300, 250, 300 bucks. Look into the blue book, folks. If you think I'm kidding, look into the healthcare blue book. Google it, healthcare blue book. The prices are transparent and it goes by the zip code. Prices are based on the zip code. Check it out. You can have a CAT scan for 200, 250 bucks. You can have an MRI for 350, 400. It all depends on where you are and what your zip code is, who the provider is. Let consumer choose to pay. If I want to fly to New York or if I to Midwest Indiana, I want to have a surgery for $8,000, I should be able to do that. I don't need to pay 200,000 in Los Angeles. I can go to across the state line in India. Let states compete. Let providers compete across the state lines. This is the beauty about healthcare, man. Healthcare needs to be very transparent and bring the cost to the front line, folks. You know, they think the consumers are, the Americans cannot handle the healthcare. That's what the impression I get it. Most of these politicians, most of these insurers, they think the Americans are stupid. They don't know. They can't handle the healthcare. They are ignorant. That's not true. Right now, I can gather the information right on your mobile phone. Google for healthcare blue book, folks. I strongly encourage for Globe healthcare and check it out. How much is the CAT scan? How much is the MRI? How much is the knee surgery? How much is your hip surgery? As a matter of fact, I can have an open heart surgery in Cayman Island for $2,500 right offshore. Right in Cayman Island, I can get it done for 25. Here it costs 250,000, folks. How could you justify that? This is not acceptable, folks. Healthcare has been dysfunctional for this long and nobody seems to care. Politicians are in the pockets of these so-called lobbyists. Where are we, guys? Come on. Look at Amazon, look at Google, look at all the other industries where they're leading. Healthcare should be in the same boat. We should be able to get, any surgery done for $2,000-$3,000. Any surgery. 90% of the surgeries can be done in outpatient setting, folks. You can have almost all the surgeries done in outpatient setting, unless somebody needs a bypass, a heart transplant, kidney transplant. That's a different scenario. They are being done at tertiary care centers. I'm not talking about those. I'm talking about day-to-day surgeries, folks. Day-to-day surgeries. They can be done in an outpatient, short-term stay facilities overnight, 1 or 2 days. They are discharged to the rehab facility. They are discharged to the subacute beds. Folks, technology is on our side. Let's use the technology. One thing I commend this pandemic because telemedicine, telehealth has changed the delivery of healthcare. Folks, yes. Doctors don't need any offices. They don't need any billers. They don't need any accounting. They don't need any billing. They can see their clients sitting right at home and make money if they want to. What I'm saying is they will provide the best care, I'm sure. America is good at delivering. You can get your medications delivered right to home. You name it. There is a provision. Amazon can deliver your medications. How about that? He can be like groceries. Come on, we are delivering groceries to the front door. Is it so difficult to have the pharmaceuticals delivered? Walmart wants to start the clinics. You don't need clinics. You can have tertiary clinics if you want. But the clinics, it are redundant. Walmart Walgreens, they all want to have clinics in the pharmacy because you can probably have, uh, you can have a clinic in the Walmart, I guess, but you don't need a full blown people who cannot be handled by telemedicine, telehealth. They need to be physically seen. Yes, I agree. We need to have clinics in Walmart, Walgreens, you name it. I'm telling you, I have no problem with that. I love competition. I love open transparency in care and the cost and deregulate this healthcare industry, man. They're being choked. The healthcare, when it comes to healthcare, I don't know what it is. Even with COVID pandemic, they have shut down the businesses. They have shut. It's too much regulation, man. I understand pandemic. Believe me, we need to be proactive and make sure that you know this is the government job to take care of the public. But what I'm saying is totally different. I'm talking about when you're not in pandemic, when you don't have a pandemic, you can have healthcare delivery right through your mobile phone, man. Right through your mobile phone. You can have your drugs delivered next day to your home. I'm not kidding. It's there. And the technology is there. Mental health, which is a major problem in our country, it can be handled through telemedicine, telehealth. We need we need to focus on mental health. This is where we're we're lagging. America can do a better job on mental health, folks. Online consultations through telemedicine, telehealth, through nurse practitioners, doctors, physician assistants, you name it. They all have to compete. They all have to compete. Open competition, folks. Open transparency. You will know upfront before you even see your practitioner how much it is. It's going to cost you. And I wish the government is, I wish Washington is listening because I want them to, instead of giving 2,000, I have, $2,000 per person under pandemic is, this is I will go along with what I'm saying. They should invest $6,000 per person, especially for people who need the most. I'm not suggesting to everyone, folks. I'm talking about people who can buy health insurance. You're talking about 18% of the population. They cannot get health insurance because of their economic status, because of their impaired status. They can't afford it. These are the folks I'm telling they should put $6,000 into their personal care accounts and focus on them. Focus just on 18%. Man, that's what you need. We can lower the cost. You can lower the cost. I'm telling you, healthcare is up for a radical change in delivery. And the last but not the least is catastrophic coverage. Let consumers decide. You have to have a premium for a catastrophic coverage. You need to have a separate, lower. You can have a catastrophic coverage based on the catastrophe. You can get coverage for whatever the limited period of time. Let consumers decide, folks. This is where we need to be on healthcare. This is where we need to be. I want to be apolitical. I love this country and I want the country to make the right decision, folks. I want President Biden to focus on people who need the most. These 18% of the population with chronic illnesses, they are economically impaired, they can't afford to. And people who don't buy health insurance, there's a solution for that too, folks. I mentioned it earlier before. People don't have health insurance. They don't buy the health. Either they're too rich, they don't want to pay for the health. Fine. They lose their exemptions, personal and family exemption. People are rich enough not to buy the health insurance. That will discourage the folks That will discourage the folks not to buy insurance. So what will happen is you'll be collecting more revenue for people with no insurance because they can afford to pay extra on your, whatever the exemptions they're getting from state and federal government, they will pay extra. That money should go to the impaired group of people, those 18%. Their claims are almost 48 to 50%, folks. We need to focus on that particular group. There is no reason to penalize the well category folks. There are no reason right now. Our healthcare industry is doing fine, except we are not addressing the primary problem, cost of the care. That's if you bring the consumers to the front line, we don't need to worry about it, folks. I can bet you on it. I'll bet you. I'll bet you my life. If consumers are in the driver's seat, you don't need to worry about it. Consumers' demand will bring the prices down, folks. Demand control healthcare, so-called consumer-driven healthcare, personalized healthcare with personal care accounts. I want everyone to have personal care, like Social Security, like you have a social. You need to have a personal care accounts for every person who deserves it. This is what who if they can't afford it, then this is their government job to provide the tools so they can have a personal care account so they can save every penny. I hope, I really hope I've convinced you guys. I'm not trying to argue from either parties, Democrat, Republican, Independent. I'm trying to give a solution for the healthcare. I want America to be number one, folks. 17.8% of the GDP is the highest contribution to healthcare than any other country in the world. India spends 1.5% of the GDP. How about that? And when we spend 17.8% of the GDP, we rank 37th among the most advanced countries. It is shameful. I just can't imagine. It is shameful, man. It is shameful to be 37th among the most advanced countries. I cannot see America in that position. I would like to see America to be number one. If they give the consumers driven healthcare, personalized healthcare, I'll bet you we will be number one. It is, we are here in number one in retail. We are number one in like groceries. We are in number one in other products except healthcare. I don't know. And the tort reform, it's easy, folks. Put a limit, 250,000 for every award, and let the healthcare professionals be the jury duty, not average folks, because they don't know anything about healthcare. You can put, instead of having this healthcare professional drawn into the jury duty for other things, put them on the jury verdicts on healthcare related aspects. I'm sure healthcare professionals will love to do that because that is their day-to-day living. So let's focus on tort reform for all the doctors, folks, all the healthcare providers. They have to have a tort reform, all the healthcare providers. This is Consumers Doctor on behalf of Foremost Organization on personalized healthcare. If you guys, I'm going to keep blasting away the same thing over and over till everybody gets it, folks. This is my goal. I would like to, before I die, I would like to see everybody to have consumer-driven healthcare. Thank you. Thank you for listening. And if you like this channel, subscribe, share, and make some comments and hit that notification bell. I love you guys. I love you. That's the least I could do as a consumer's doctor, to give the advice. This is this is what I have taken a Hippocratic oath to provide these services to every human being, irrespective of where they come from. This is all the healthcare professions take Hippocratic oath before they become doctors. That's their job, and you need to have a satisfaction of taking care of the needy. That's the vital thing, folks. That gives you sense of gratification. Thank you, guys. Salute.